My name is Chloe Batten. I'm a registered nurse, and I'm here to talk to you about your recent diagnosis of diabetes mellitus or type 2 diabetes. So, the way that the body works when it breaks down food is you eat a meal, and in your stomach, your meal is broken down into the basic building blocks that the body needs to function. And one of those building blocks is glucose or sugar. Um, when the body is functioning normally, you can think of the analogy of glucose in the bloodstream, and the cell has a door, the cell that needs that glucose, and a special hormone called insulin opens that door because it's a key. And in the cell, the glucose is changed into something called ATP, which you can think of as a battery for the cell. So when you have diabetes, your cells in exhibit something called insulin resistance. So the key that is that insulin is rusty, or it gets stuck in the lock and it's not working effectively. And so sugar or glucose builds up in the bloodstream. The thing that's really dangerous about that is that excess sugar in the bloodstream can cause long-term side effects. The symptoms that you might see initially um, would be increased thirst, increased needing to pee, or fatigue, or wanting to eat more food. But then long-term effects are more dangerous, such as heart attack, stroke, kidney failure, um, vision loss, tingling in your fingers and toes, and then sometimes even loss of fingers and toes and limbs. So what we can do to help reverse your diabetes or make it better so that you don't have those long-term side effects are lifestyle changes. And one of the biggest risk factors for diabetes is obesity. And one of the things that we can do to change that is by changing our diet. And that will also help with our diabetes as well. The diet recommendations are a low carb diet, and having those carbs or carbohydrates be healthy carbs. Lots of fruits and vegetables, which are high in fiber and have the good kind of sugars that our body needs. Eating meat is okay, but we want to eat lean meats and not fatty meats because we don't want things that are high in cholesterol and high in bad fats or saturated fats. So we want to avoid processed foods and things that are fried. Um, Fish is an excellent source of protein. And then if we do eat dairy, we want it to be low-fat dairy. So avoiding things like butter or whole fats in doing 2% or low fats or skims. Exercise is extremely important. 30 minutes a day of moderate exercise or 150 minutes a week is what's recommended. You can do that through brisk walking or swimming or cycling. And then quitting smoking, if that's something that you're doing, and drinking alcohol are two of the other factors. If lifestyle changes are not enough by themselves, there are a few medications that we can try. Some are taken by mouth and some are injection. Some of the big medications and their mechanisms of action or how they help your body are metformin, which decreases the glucose that your liver produces and helps with glucose or sugar uptake of the cells. There's GLP-1 receptor antagonists, and those help increase your insulin sensitivity to the cells, and it can help with weight loss as well. There's SGLT2 inhibitors, and those can help secrete glucose or get rid of glucose in your urine. So those are the few things that we can do to help reverse your diabetes and help to manage it. What I would like for you to do is take a look at the list of exercises as well as the foods that I have provided you and come up with a meal plan for yourself and exercises that you feel are realistic and make sense for your lifestyle. And we can take a look at those next week and determine what is best for you and how to move forward.